Isang makakalikasang araw po sa ating mga tagapakinig at welcome sa panibagong episode ng Central Luzon Envy Heartland Podcast. Kasabay sa paglaki ng bilang ng kaso ng COVID-19 ay ang nakakabahalang paglaki ng ating mga basura, lalo na ang bilang ng ating tinatawag na infectious o medical waste na hindi na lamang nanggagaling sa mga ospital, ngayon ay pati na rin sa mga quarantine facilities at maging sa mga kabahayan. Narito po si Engineer Danilo Rodriguez ng Environmental Management Bureau, Region 3, na makakasama natin para sa ating episode ngayong araw. Magandang araw po, Engineer Rodriguez.
Isang makakalikasang araw sa ating mga tagapakinig. Narito ako upang magbahagi ng kaalaman patungkol sa mga medical at infectious waste at kung ano ang epekto nito sa atin at sa ating kapaligiran.
Para po sa ating unang katanungan, ano po ba itong tinatawag na medical or infectious waste?
Ayon sa United States Environmental Protection Agency, ang medical waste ay nagmula sa mga healthcare facilities such as hospitals, physicians' offices, dental clinics, blood banks, and veterinary hospitals and clinics, as well as medical research facilities and laboratories. Dito sa Pilipinas, ayon sa DNR Administrative Order Number 22 Series of 2013, ang infectious waste ay isang uri ng healthcare waste suspected to contain pathogens tulad ng bacteria, viruses, parasites, or fungi in sufficient concentration or quantity to cause disease in susceptible hosts. M501 ang classification of pathological or infectious waste under DAO 2013-22. Ang infectious waste ay may subcategories gaya ng pathological waste and sharps. Ayon sa Joint DNR-DOH Administrative Order Number 2 Series of 2005, ang pathological waste consists ng tissues, organs, body parts, human fetus, and animal carcasses, blood, and body fluids. Ang sharps naman ay needles, syringes, scalpels, saws, blades, broken glass, infusion sets, knives, nails, and other items that can cause a cut or puncture wounds. Whether or not they are infected, such items are usually considered as highly hazardous healthcare waste.
Marami po palang categories itong infectious waste o ang M501. Saan naman po ang mga sources ng mga ito?
The main sources of infectious waste are the hospitals, medical centers, laboratories, and clinics. Ngayong pandemic, naging main sources din ng mga quarantine facilities, vaccination areas, household, offices, and private institutions.
How many tons of medical or infectious waste po ang nakolekta before and during the pandemic?
There is a significant surge on infectious waste recorded in Region 3 at the time of COVID-19 pandemic. Sa taong 2019, bago ang pandemya, the recorded amount of treated M501 o infectious waste was 1,105 metric tons. As for the year 2020, the recorded amount of treated M501 or infectious waste was 13,306 metric tons. Nagkaroon ng 1,204% increase from 2019 to 2020. As for the year 2021, sa ngayon, the recorded amount is 36,746 metric tons, having already 276% increase from the previous year. The data collected are based from the submitted self-monitoring reports from the different firms from Region 3.
Kamusta naman, sir, ang performance or monitoring of the region in treating and disposing of medical waste?
EMB Region 3 conducts regular compliance monitoring of healthcare facilities in compliance with Republic Act 6969 o mas kilala sa Toxic Substances and Hazardous and Nuclear Waste Control Act of 1990 at iba pang environmental laws mandated by the office. Makare-receive ng notice of violation ang mga healthcare facilities na makikitaan ng violations ng lahat ng applicable environmental laws. Treatment and disposal of infectious waste are monitored through the online hazardous waste manifest system. Sa ngayon, computer-generated na ang permit to transport, manifest, and certificate of treatment. Monitoring database for healthcare facilities was also established to monitor hospitals, clinics, and quarantine facilities within the region's jurisdiction.
Ilan na po ba, sir, ang TSD registered to treat M501 within Region 3?
As of November 2021, mayroong 11 registered TSD facilities na nagtitreat at nagdi-dispose ng M501 o infectious waste sa Region 3.
What are the risks and the contaminations of these infectious or medical waste?
In our health, infectious waste may contain any of a great variety of pathogenic microorganisms. Pathogens in infectious waste may enter the human body by a number of routes: through a puncture, abrasion or sugat sa balat, through the mucous membranes sa ating paghinga, or by ingestion. In our environment, land, air, water, dahil sa pagtaas ng demand of PPEs against COVID-19, significant increase of medical waste generation was recorded. Dahil dito, increasing amount of M501 or infectious waste are being disposed to sanitary landfills. Improper segregation and disposal of infectious waste has the potential to contaminate groundwater sources na maaaring makadulot ng sakit sa tao at mga hayop. Ang mga waste na ito, if not properly contained, segregated, or incinerated, it can also contaminate the air we breathe through dangerous airborne particles.
For our last question, sir, to prevent the risk, how to properly dispose the infectious or medical waste?
From hospitals, ayon sa DAO 2013-22, proper segregation, labeling, and storage requirements should be strictly followed by the healthcare facilities. Mandatory treatment and disposal of the infectious waste with the registered TSD facility should be done in accordance with the online hazardous waste manifest system. From households, ang unang hakbang is to minimize generation of infectious waste such as face mask by using reusable face mask if possible. Ang publiko ay nire-require to practice proper waste segregation para maiwasan ang cross-contamination at ang patuloy na pag-spread ng COVID-19 sa ating komunidad. Ito ay para sa ating waste management workers to be safe as well. Proper labeling should also be implemented as per RA 9003 or the Ecological Solid Waste Management Act of 2000.
Thank you very much po, Engineer Danilo Rodriguez. Any message or takeaways po for our listeners?
COVID-19 has changed our way of life, but through this pandemic, we can raise awareness on the environmental issues arising, especially on the impacts and risk of improper solid and hazardous waste management. By being informed, let us protect the environment as we protect each other against this COVID-19 pandemic.
Maraming salamat po, Engineer Danilo Rodriguez, sa inyong pagbabahagi. Naway marami pong natutunan ngayon ng ating mga tagapakinig. Ito po ay isang paalala na lahat tayo ay maging maingat at maging responsable sa pagtatapon ng mga infectious waste. Patuloy pa rin po ang pagbabahagi namin tungkol sa iba't ibang paksa na naglalayong protektahan ang ating kalikasan. Ito po ang Central Luzon and by Heartland Podcast. Hanggang sa ating muling talakayan. Lagi nating tandaan, ikaw, ako, tayo ang kalikasan.